Hi, everyone. I'm Gretchyn Bailey, and I am a fellow of the American Academy of Optometry. I am joined today by Nora Cothran, who is also a fellow of the Academy, as well as a glaucoma specialist at the Eye Institute of West Florida and a former intelligence officer in the Air Force. Hi, Nora.
Hi, Gretchen.
Thanks for joining me today.
Thanks so much for having me.
Let's talk about the ZAP study, which is the official title of this study is 14-year outcome of angle closure prevention with laser iridotomy in the Zhongshan angle closure prevention study. And this was conducted by Yuan and colleagues, and it was published in the August 2023 issue of Ophthalmology. This extended follow-up to a single center randomized controlled study aimed to evaluate the efficacy of laser peripheral iridotomy, or LPI, prophylaxis for patients with primary angle closure suspect, or PACS, after 14 years, and to identify risk factors for the conversion from PACS to primary angle closure, or PAC. A lot of acronyms there.
A lot.
So, Nora, can you tell me what is the ZAP study and why is it significant?
I think that this is really important because about 10 years ago, when I started clinical practice, I saw all these patients that had LPIs. I mean, if anyone had a somewhat narrow angle, LPIs for everyone. And what the ZAP study did is it actually used a patient's contralateral eye as the control. So in the original study, almost 900 patients were enrolled. One eye got a prophylactic LPI, the other was as a control, and they followed these patients forward into the future. The original trial results showed that maybe not everyone needs an LPI. There was a very nominal effect of LPI in reducing the risk of acute angle closure attack, especially angle closure attacks that resulted in IOP that was high or lasted long enough to actually result in irreversible field loss. What this showed was that the potential for something called compression gonioscopy, meaning being able to put your gonial lens on the eye and pressing in to see the structures, may actually be the gold standard instead of LPIs for everyone.
So that was the original study, and now we have this extended study. What were the results from the extended study?
The results from the extended study let us know that for those patients that did have the LPIs, they had a much less instance of developing peripheral anterior synechiae in that angle. So it didn't dramatically reduce their risk of actually having an acute angle closure, but what it did is keep a little bit of that angle a little healthier and a little less prone to scarring, fibrosis, any type of additional changes that might happen. The limitation is that of the original almost 900 patients in the study, a very small amount of those that were actively treated were actually able to be followed up. And so the actual statistical significance and thus clinical relevance is slightly limited with this 14-year follow-up.
Given that, what do these results mean for the management of glaucoma?
I think that what this means for optometry is that optometrists need to blow off their gonial lens and to utilize it. If you don't use it, you lose it. And you actually might physically lose the gonial lens in your office if you don't use it. But not everyone that has a narrow angle necessarily needs an LPI. Blow off the gonial lens and put it onto the eye. And if you can see angle structures with gentle compression, and if a significant portion of the angle is not closed or occludable, then waiting and watching is perfectly appropriate. Not everyone needs an LPI. In this day and age, I think that it is okay to be a little more judicious in our management, a little more conservative, instead of putting a patient through a procedure that may have a limited amount of benefit in the long run for them.
So let's turn specifically to optometry. Why does this study matter to optometrists?
This is extremely important. In many of our states, optometrists are behind the laser. They're not referring out for LPI. They're walking the patient down the hall and doing the laser themselves. And I think that by understanding who is the most appropriate candidate for laser and why they need it, understanding the mechanism of action, as we start moving into scope expansion within different states, using our privileges and using them very judiciously is extremely important for not only the reputation of the profession, but most importantly for the health of the patient.
Nora, thank you so much for talking with me today.
Thank you. It was great to be here.